Our next speaker, Dr. Reena Sethi. She'll be speaking on changing scenarios in ophthalmic practice for the anterior segment, and Dr. Mahipal will be joining us shortly.
A very good morning to all.
Thank you.
I'll be talking about the changing scenario in the anterior segment practice. I'm going to take it in two perspectives. Number one, we'll start with is the patient perspective, which we usually forget. And that is what the patient says to us. When the patient is in our OPD or is undergoing treatment from us, he says that I am more than just a number, because that's what they don't want. It's about whether I can drive. It's what I say that counts. Why aren't you listening? And what does the patient mean when he's saying all this? He means that whatever you do with me or treat me, quality matters, because that at the end of the day is the patient is going to follow you only if you give him good quality vision services. Prioritizing your outcomes. It's very important to understand what exactly is the priority of vision whenever you're going to operate on the patient. Is the patient's need for near vision, intermediate vision, or distance vision more important? That has to be, the patient has to be given chair time. You have to individualize the treatment to the end point. What is the result? Is the patient going to be satisfied with the result that you're going to give the patient? All that should be thrashed out with the patient. They should be made to understand in giving them time, and the expectations and limitations should be understood. So that's what the patient is asking of you. Realigning of ophthalmic care through hearing the patient's voice that's what us physicians should do. And what is our perspective? Our perspective, now what exactly has changed over this time? I think the number one thing that has changed is our tools have changed. Our way of practicing is different today because the different technology that we are using has absolutely changed. What has happened? Right from the time when the patient enters your clinic, because of your standards, your accreditations, you need to have a proper EMR system where the patient is received, the time of entry is noted, the time of exit is noted. You have a lot of tools which are artificial intelligence integrated, like your calculations of your, in anterior segment, if I may say, calculation of your IOL powers, and also the other mobile apps which you have, in which the patient can track your records as well as you can actually give your patients his medical records as well. All the medical legal issues have to be kept in consideration, because you have to have proper documentation of how the patient is doing and what are the procedures that you have followed. So these are all accreditation-based practices. Now, what else has changed in our practice? The way we image the patients, the way we are doing the ocular surface imaging. These are all new horizons that have started. Meibomian gland imaging, the corneal biomechanics, and all these tools are all usually swept source OCT technology, aberrometry, 3D printing, and eye tracing. Now, these tools are very essential. Now, whenever we need to give good outcomes to our patient, we need to have one or the other tools. That is going to make our confidence, and the moment we are confident, we can explain to the patient that, we are going to be offering you a good outcome as well. Our approach has changed. What is the approach now towards surgery? We are targeting emetropia. Our cataract surgeries are more and more refractive surgeries. We are countering coexisting astigmatism that we are tackling, because any patient who comes with us with astigmatism needs to be corrected as well. We have different technologies for that. We have the femto laser, we have the latest MyLoop, we have different intraocular lenses in our domain. We have the EDOF lenses, and the toric IOL, I think, is one lens that has given a lot of satisfaction to our patients. So all these tools which we have with us help us in giving proper services to our patients. And the approach towards surgery has become treating also presbyopia with all these different IOLs, and as well as your refractive surgery, the SMILE procedure, and topo-guided refractive surgery. These are the changing trends. Now, what exactly is going to be reflecting out of this? We have more TPA complexities, like Mr. Tulsi Raj just explained, that it's just not seeing the patient and delivering the services to them, but then also the intermediaries which we have to deal with, the TPAs, the capping of implants, and the Ayushman Bharat scheme that is coming and hovering on us. So basically, we are facing a dilemma where the cost of treatment is rising, promising good outcomes is there, but then we have to balance it out with the economics as well. Thank you very much.
Thank you.